Hello, Elizabeth Scala here with Living Sublime Wellness. And one aspect of my business is each month we focus on one wellness theme. This month the theme is awareness. Now when thinking about awareness, one might come up with similar terms or other words or experiences that have to do with this concept. You might hear the terms consciousness. You might have heard mindfulness, being in the present moment, being in the here and now. And one tool that I like to use that for me really helps with all of these concepts is that of meditation. Meditation sometimes can be a scary word, but before we get nervous and start coming up with excuses, not having time, different things like that, let me just share with you a couple of the benefits to meditation. So some of the physical benefits are it lowers oxygen consumption, it can decrease respiratory rate, it increases blood flow and slows the heart rate, it can actually be good for people with high blood pressure, it can reduce anxiety and stress, it even decreases muscle tension, it even helps reduce premenstrual syndrome symptoms. It enhances our immunity system. It can help with concentration and relaxation. So there are many, many benefits to meditation, even many more than I've just shared with you today. And why am I speaking about meditation to us as nurses? Well, thinking about the nursing profession, in any of the roles that you may have as a nurse, you, I'm sure, are busy, sometimes stressed in your specific job or specific work day. You know, we have a career that involves a lot of multitasking, a lot of questions and answers, a lot of needing our attention. You know, just being in a simple one work day in a span of just a few minutes. A nurse can be interrupted, called upon, asked a question, called on the telephone, all sorts of things just within minutes. So it's a very, very busy and fast-paced career. Now, I know I'm speaking to you and you know this, but that being said, meditation is something that can actually help you to increase your focus, to help you be more present in that moment with the patient or the client, to help you reduce stress and anxiety, and really just can help you balance the flow of the work day. So I just want to share briefly my own journey, because I know when people hear the word meditation, sometimes they picture monks, in a far-off land chanting mantras for 45 minutes to an hour to all day. Sometimes people worry it's painful or uncomfortable. Sometimes people worry they're going to fall asleep. So, just briefly, in 2010, in the summer, I went through my first coaching certification program, and in week 2, we really focused a lot on being in the present moment, being able to really listen, being mindful when speaking with clients, being aware of how we're feeling and reacting to what's going on. So really being in that here and now. There was a reading list, and one of the books I chose to read during the course of the class was Full Catastrophe Living by Jon Kabat-Zinn. And that book has really been sort of my really strong introduction to this whole lifestyle, really. I've read the book now about 2 times, and I always refer to it, so it's a great book. Anyway, that book really introduced me to being more mindful and focusing on my breath. So I kind of was getting an understanding of what some of the meditation practices were about. Now, there are many different types of practice, but this was just one that I was reading about. The problem, though, where I was not being fully successful was I was practicing meditation sometimes when I would get home from work, sometimes on my lunch break, sometimes in the morning if I had time, maybe in the evening before bed. And it was happening sporadically. It was not happening every day. Recently, in May of 2012, I've met another instructor, another guide along my wellness journey, and have been introduced to a new tool, and not only that, really was reinforced with the concept of it needs to be a daily practice and it needs to happen at the same time every day. So, if you're looking to begin some sort of meditation practice, you want to make sure it's on a daily basis to get the most benefits. It's happening at the same time of day so it becomes a routine, that you're in a quiet space, that you close the door, that you tell others so you're not interrupted, that you turn off the electronic devices, and that you get in a comfortable position so that you are able to practice for some time. Now, in the beginning, if you're just starting out, it does not have to be 25, 30, 40 minutes long. Start out with 5 minutes a day, increase to 10. Do whatever is going to fit into your lifestyle, but do it on a daily basis at the same time so you get the full benefits of the routine. As nurses, if we are able to practice this one technique, we will be more present with our patients, we will be less stressed with our job load, and we really will be in the here and now in the moment with our staff, with our clients, with ourselves, so that we are aware and conscious of everything around us. If you'd like more information or you want help getting started with your own practice, feel free to check out my website and give me an email. So come visit us at livingsublimewellness.com. Thank you and have a great day.